Welcome dear friends for the SWAYAM MOOCs on the introduction to the basic veterinary diagnostic imaging. Today we are going to discuss about the basic of the computed tomography. I am your course instructor Dr. Rahul Kumar Udaiya, Assistant Professor, Department of Veterinary Surgery and Radiology, Faculty of Veterinary and Animal Science, Banaras Hindu University. Let's start CT scan or the computed tomography. So today we will discuss the following topic under the CT scan: introduction of the CT scan, history of the CT scan, basic principle of the CT scan, component of the CT unit, image matrix, use of CT in the animals, various benefits and the risk regarding this CT scan, advancement and various trends in CT, and finally we have to conclude the today's lecture. So let's start from the introduction. So computed tomography. The computed tomography having a very long history. So it was started from the PET to CET like that, sorry, CAT like that. So in recent trend we are knowing this as a computed tomography. Previously it was known as computed axial tomography, CAT scan. The CAT scan is just originated from the Greek word, that means tomo. Tomo means slice in a sections. So in computed tomography we are using X-ray, so that these X-ray images in the form of slice. So that's why it is called as a tomography. So this computed tomography is a non-invasive medical examination procedure that use a specialized X-ray equipment to produce a cross-sectional image of a body. Let's discuss about the history of the CT scan. The CT scan was discovered by Godfrey Hounsfield in 1970s. But it was invented, the credit of the invention was given in 1972 to the Godfrey Hounsfield, so that this CT scan was first installed for clinical purpose in between 1974 to 1976. The Godfrey Hounsfield is called as a father of a CT scan, so that he got a Nobel Prize in 1979 for discovering of this CT scan. Previously this CT scan was originally developed for the imaging of brain, because the limitation of radiography for the imaging of brain. Today a wide range of the body examination with the CT scan is performed for head, for thorax and the abdomen. So this picture is showing whole assembly of the CT scan. The CT scan unit is containing the CT scanner, this is a main unit, patient bed, computer, various monitors, control panels and remote workstation for the physician. So this is a whole assembly for the CT scan. Let's discuss about the basic principle of the CT scan. So in the CT scan, the image is reconstructed from the large number of the absorption profile taken at the regular intervals around the slice each profile being made up of from the parallel set of the absorption value through the object. So, this is a basic principle of the CT scan. So, here you can see the cross section of the CT machine. So, there is a X-ray tube and the detector is clearly you can see in the image, and the round blue circle is a patient. So, multiple X-ray beams are passing through the CT from the patient and detected by the detector. So, this is a whole procedure. The CT scan produces the axial section or cut or the slices of the patient body, and it is recorded by the detector and send it to the computer. So, in CT scan is made up of multiple X-ray attenuation measurement around the object periphery. So, the fan shape of the X-ray beam is passed through the patient, then the X-ray beam may get attenuated by the patient, and this attenuated X-ray is detected by the detectors present in the CT scan machine, and then there is a production of the light by the detector, and that light photons may get strike to the photocathode, and that photocathode is releases the electron. These electron reaches into the electric circuit and it is converted into the digital number by the computer and form an image. This is how the CT scan get work. Let us discuss about the component of the CT unit. The CT unit is containing the gantry, patient table, power distribution unit, operator console. These are the main component of the CT unit. Let us discuss one by one each component. First is a gantry. The gantry includes the X-ray tube, the detector array, the high voltage generator and patient support couch. So, in this image you can see a big structure having a round opening. So, this is a gantry. So, now let us see a cross section image of the gantry. Here you can see the cross section image of a gantry. The topmost part is a X-ray tube from where the X-ray beams are come out, and the collimator. So, because of this collimator, a narrow escape of the X-ray beam is present in a gantry. Another important thing is a detector, which is just located, it is all around of this gantry. Generators, which is very important, so that high amount of kilo voltage is produced by this generator. Patient bed, so this movable patient bed can use is located just in front of this gantry. So, this is a cross section of a gantry. Let us discuss the patient table after the gantry. So, the patient table is a flat and strongly curved platform where the patient lies during the scan. So, this table is responsible for the positioning of the patient, so that the patient may get enter into the gantry. So, this patient table having certain function, like you can up and down the table, you can forward the table, you can backward the table, like that. So, patient table you can control with the control panel. The patient table you can redesign according to the veterinary patient, because the veterinary patients are having a different in the size and the shape when compared with the human, so that you can make the patient table according to the convenience. But one point you have to remember, that the patient table should always be a radiolucent, not a radio opaque material. Another is a power distribution unit. The power distribution unit is a power supply of the X-ray tube, scanning the movement of drive motor, table and the detector. The X-ray tube require a very high voltage, high kVp and supplied at a very high current. These high voltage, high current demand also require a very flat switching, soft rise and the fault times. The power distribution unit is housed in its own room or a cabinet. Often this high current, high voltage drivers are water cooled, because there is generation of heat during scanning. Another important component of the CT unit is operator console. The operator console is having 2 to 3 consoles. One console is just used by the CT radiologic technologist to operate the imaging system. Another console may be available for the technologist for post process image, for filming or filling, like that. The third console is important console, is used by the physician, who are used this console for interpreting the CT images. He can manipulate the image contrast, image size and general view appearance. So this operating console contains controls and the monitor for the various technique factor. The operating console usually include the 2 monitor, one provide for the operator to annotate the patient data on the image, and the second monitor allows the operator to view the resulting image before transferring it to the hard copy to the physician viewing console. Here this picture is showing the console room. Here you can easily see the monitors, 2 to 3 monitors are present, control panels are there and one LED glass also you can see in this image. So with this LED glass you can easily see the gantry as well as the patient table, so that you can easily manipulate the things according to the requirement. Last is a physician workstation. Physician workstation is always away from the main console. So this console allow the physician to call up any image and manipulate that image to optimize the diagnostic information. The manipulative controls provide for contrast and the brightness adjustment, magnification technique and use of online computer software package like Diacom software. So this slide is showing the workstation for the radio technician, operating console for the radio technician in a console room. After discussing this CT unit, we will discuss about the image matrix. The CT image format is consist of many cells, each assigned number and displayed as an optical density or the brightness level. The CT imaging system provides a matrix of 512 into 512, resulting in a 2,62,144 cell for the information for one cell. The each cell of information is called as a pixel. It is a picture element, and the number or numeric information contained in each pixel is a CT number or a Hounsfield unit, so that the image matrix for the CT scan is always called as CT number or the Hounsfield unit. The pixel is a 2D representation of corresponding tissue volume. The diameter of the image reconstruction is called as the field of view, FOV. The FOV or the field of view is increased for the matrix size, and the size of each pixel is increased proportionately. The tissue volume is known as a voxel. Voxel is again a very important component of a CT unit. It is a volume element. It is determined by the multiplying of pixel size by the thickness of the CT imaging slice. So, this chart is showing a various measurement of CT unit or the Hounsfield unit for various substances. The 0 unit is represented by the water, while minus 1000 is representing by the air. When we are going toward the metal side, it is increasing from 100 to 3000 CT unit or the Hounsfield unit, while we will see for the bone is approx 100 to 1000 unit. For mineral it is 100 to 1000 again. For kidney it approx 30, for brain it approx 30 to 40. For lungs it is minus 845. Okay. How will you calculate this Hounsfield unit? The Hounsfield unit you should calculate by the linear attenuation coefficient of tissue minus linear attenuation coefficient of water, multiplying by the 1000 divided by the linear attenuation coefficient of a water, and you have to calculate the CT unit. So, in the CT scan you can see the grayscale of various tissue. Air is totally black and white is totally by the metal and the bone. So, this is a CT unit. Now, another important point related with the CT scan. The CT scan should be performed while patient is under general anesthesia. Therefore, prior to scan, blood work is required to be sure the patient is healthy enough to tolerate the general anesthesia. In patients suspected for having cancer, chest radiograph is also required prior to anesthesia. Clinical application of the veterinary CT. So, we can use the CT scan in the patient with the head or the spinal trauma to visualize the skull fracture, any type of hemorrhage, any type of intervertebral disc diseases, like that. Any affection related with the nasal cavity or trauma or sinuses is also you can use to detect related with the nasal cavity or the sinuses. Masses, foreign bodies, rhinitis, any fungal infection you can diagnosed with the help of CT. Thoracic and the abdominal CT you can use to diagnose any pulmonary nodule and a metastatical mass or any organ abnormality. The CT scan is also used to detect any type of tumor. You can localize the tumor, you can detect the stage of the tumor. It also aids in the biopsy planning and radiation therapy mapping. You can also use the CT scan for orthopedic surgery or any type of surgical planning. So, you can also evaluate the 3D evaluation of the complex fracture and joint abnormality may get planned for the surgery. Pre-surgical assessment of the precise intervention you can also get from this CT scan technique. So, this is a normal CT of a dog, while another CT is showing three-dimensional reconstruction of a dog with highly invasive nasal neoplasm that has destroyed a large portion of the maxilla, nasal bone and the frontal bone and the right zygomatic arch. Clearly appreciate this is a 3D reconstruction of the CT. Now, application of the CT in veterinary patients. For a small animal, for dog and cats, commonly used for a brain, spinal cord, thorax, abdomen and tumor diagnostic. It can also be used for diagnosing of any tumor or oncology in the case of any trauma, severe trauma cases and in the any neurological evaluation. For the large animal, so there are many limitations for the large animal, especially in the equines. So, only few portion of the body can get scanned with the help of the CT. So, the limb CT you can scan for the case of fracture, navicular diseases, any disorders. You can also scan the head of equine for any type of dental issues like sinuses, dental abscess, root canal abscess, skull trauma, etc. You can use the CT scan for the wild animal or wild species also, or exotic animals like birds, reptiles, small mammals, which can get passed through this gantry. You can use for evaluation. So, it can help to assess the trauma, respiratory disorder, any type of tumor or mass evaluation without exploratory surgery. So, these are the certain application of the CT you can use in the veterinary patient. Now, benefits and the risk. So, unlike of another imaging, the CT scans offer the detailed view of many type of tissue including lungs, bone, soft tissue and the blood vessels. It is having a benefit like it is a painless procedure, it is a non-invasive procedure and very precise, accurate information is given by this CT technique. It is very fast and simple technique. It also eliminates the need of invasive exploratory surgery and the surgical biopsy. We can identify both the normal and the abnormal structure, making it a useful tool to guide a radiotherapy, needle biopsy and other minimally procedure. So, these are the certain benefit regarding the CT scan. Let us discuss about the risk. The CT is having only major risk of the radiation hazard. The CT does involve exposure of radiation in the form of X-ray. but benefit of accurate diagnosis is outweigh the risk. The effective radiation dose of this procedure is same as the average person receive the background radiation in 3 years, radiation in 3 years. Another important risk regarding the CT, because sometimes the CT scan require a contrast agent. Iodine based contrast agent is used in the CT scan, so that there are a risk of serious allergic reaction to the contrast material. So this is a one type of risk. So let's discuss about the advancements and the trends in the veterinary CT. So dual energy CT is using nowadays. So it is uses 2 energy level to improve the tissue differentiation. It helps in the identifying the mineral contents, contrast enhancement, and the tumor characterization. The contrast enhancement CT is one of the other advancement technique that enhances the visibility of the blood vessels, organs, and the tumors, critical for the assessing the perfusion or the vascular invasions. CT angiography is one type of another advancement. It is a non-invasive vascular imaging technique useful in the diagnosing vascular anomalies, thrombi, and the surgical planning. 3D printing and surgical modeling. The CT data can also be used to create 3D printed model. Nowadays, these are in the fashion. Help in a pre-surgical planning, education, and the client communication. Nowadays, the CT machines come along with the AI assisted image analysis, artificial intelligence assisted, the automated detection of segmentation of abnormalities, improve diagnostic accuracy, and reduce interpretation time. So these are the certain advancement and the trends in the veterinary CT. Now finally we conclude the CT scan in veterinary. So the CT scan is a highly valuable diagnostic tool in veterinary as well as in medical imaging. It offers the superior anatomical detail, especially for bone, thoracic, and soft tissue evaluation. It is non-invasive, quick, and highly accurate imaging modalities, play a crucial role in surgical planning, oncology, neurology, and the trauma assessment. So this is all about the basics of the CT in veterinary. Thank you.